Mosquitoes, wasps and bees. Several types of insects can sting or bite us. Most cause slight discomfort or pain and do not pose a serious threat. But in some cases, a bee sting can lead to serious complications. If the patient has an allergic reaction, it may even lead to death. Our topic for today: first aid for bee sting. Bees live in our surroundings. The presence of their hives on trees in our vicinity is a common occurrence. Normally, bees do not pose any threat, but they may sting us if they feel threatened. Bee stings are extremely painful. Bees have stingers that are thorny and attached to their stomachs. They also have a venom sac. When a bee stings, its stinger gets embedded in the skin. In most cases, the bee dies after it stings as its stomach ruptures. Let us see how to administer first aid for a bee sting. First and foremost, take the person to a safe location and calm them down. Ensure that it is a bee sting. A bee sting is extremely painful, but you should check the sting site without panicking. The barbed stinger of the bee often remains embedded in the skin, and this is how it looks. Check carefully to determine if the stinger is embedded. If it is important to remove it immediately. Never try to remove the stinger by pinching, scratching, or pressing. Do not attempt to pull it out with a tweezer. Such attempts may push more venom into the skin and add to the severity of the pain. To remove the stinger, you may use a plastic card like the ATM card or driving license, your fingernail, or the blunt side of a knife. Whatever you may use, hold it inclined at an angle and push the stinger out carefully like this. After removing the stinger, wash the sting site with soap and water. If the pain is intense and the area is swelling up, you may apply a cold compress. Never apply ice directly to the skin. Bee venom is acidic in nature. That is why an alkaline application helps in relieving pain and burning. Add a little water to baking soda and make a thick paste. Apply this to the sting site. Repeat application after 15 minutes if there is no relief. Consult a doctor to give pain relief medication or an anti-allergic. Do not give any medicine without a doctor's advice. Now, some very important information. Some people may have an allergy or serious reactions to bee venom. The symptoms can be severe. Difficulty in speaking or breathing. Body starts swelling up. Nausea or vomiting. Skin eruptions that burn or itch. Dizziness, sweating, or sudden weakness. All these are symptoms of an allergic reaction. This is a medical emergency. Arrange for an ambulance immediately. Pay special attention to the person's breathing. Make the person comfortable while waiting for medical help. Reassure the person that help will arrive soon. If you do not know anything about the sting, then it is safer to do nothing and call for help from the nearest doctor or hospital. Remember, different insects have different stings. The barbed stinger of a bee is very different from that of a wasp or a mosquito. The stingers of wasps and mosquitoes do not remain embedded in the skin. Another fact is that the venom of a wasp is alkaline in nature, so it will not help to apply baking powder paste on it. Safety and prevention are better than cure. Let us learn how to protect ourselves from insect stings and bites. Wear long-sleeved garments and keep your legs covered completely amidst tall grass and greenery. You may tuck the ends of your pants in your socks like this. This will prevent any insect from getting into your clothes. Never play around with any insect. Do not disturb a hive, as bees are known to attack in groups when disturbed. Remember, bees are important for our agriculture and ecology. Today, there are 2 tasks for you. First, list all the insects that can sting us. What are they called in your mother tongue? Gather more information about them. Find out what happens if they sting us. Collect their pictures if possible and share them with others. Second task, perform a role play for administering first aid for a bee sting. Make a video if possible and share it with others. Learn first aid. Stay alert, stay safe.